I'm Joe Ditre, and I serve as the Executive Director of Consumers for Affordable Healthcare. And as you may know, I'll be leaving Consumers for Affordable Healthcare to take a position with Families USA in September in Washington, D.C. And before I leave, I just wanted to again say a few words of thanks to some very important people who helped us to develop our purpose, to develop partners, as well as to develop goals for the organization. And as you know, every organization needs a philosophical basis. It's the why of its existence, and I wanted to share a little bit with you about the why of Consumers for Affordable Healthcare Coalition. Ed Sperrer was one of my law school professors at the University of Pennsylvania Law School, and he was a mentor to me and many others. He was the general counsel for the National Welfare Rights Organization. In 1963, he founded Mobilization for Youth, which was the first neighborhood legal services program in the United States. In 1965, Ed founded and was the first director of the Columbia University Center for Social Welfare Policy and Law, which was the first national support center for legal services organizations nationwide. Ed wrote an article called Gordian Knots, The Situation of Healthcare Advocacy for Poor People Today. He wrote that article in May of 1981. In it, Ed laid out 5 basic principles for reforming our approach to advocacy as lawyers for the poor, as community organizers, as activists, and as advocates. And one of them was to conduct our advocacy in such a way as to maximize the potential for professional, institutional, and organizational allies to work together as allies of common people to change the healthcare system. That seemingly simple concept provided the philosophical basis or the purpose for all of the organizing work that we did at Consumers for Affordable Healthcare Coalition. Now, thankfully, that concept made sense not only to me, but to a lot of advocates and healthcare professionals and healthcare providers and civic leaders, legal services lawyers and organizations which joined Consumers for Affordable Healthcare Coalition. Not only people who you'll see on our corporate documents, like Peter Stoll, who is the Executive Director of the Developmental Disabilities Council, or Laura Fortman, who is the Executive Director of the Maine Women's Lobby, or Betsy Sweet, who was a lobbyist, and who were our incorporators in 1997 of the organization, but also to legislative leaders, and I just want to mention one. Charlene Rydell was the House Chair of the Banking and Insurance Committee, what is today called the Insurance and Financial Services Committee. If you look back at any of the major reforms, healthcare reforms that were adopted all throughout the 1990s, you'll find reforms such as no pre-existing condition exclusions or waiting periods, community ratings so that older people don't pay much more than younger people, guaranteed access to coverage, which is also known as guaranteed issuance and renewal, the Patient Bill of Rights. Each of these reforms was authored by Representative Charlene Rydell. Now, Charlene often handed these bills off to her legislative leaders to take credit for, but it was Charlene Rydell who authored them. Without people like Ed Sperrer and Representative Charlene Rydell, and all of the people who helped us to form this organization, we would have never achieved what we did achieve, nor would we be here today and working together on healthcare reform in the future. So to all of them, I say thank you. Thank you for all of your hard work, and I very much appreciate all that you've done for Consumers for Affordable Healthcare.